priming IV tubing and regulating flow rate, the first thing we'll do is check the chart for the doctor's order. So, stated here in the doctor's order sheet, Dr. Arla Herrera wants to start an IV therapy with PNSS 1 liter at 20 drops per minute, which will start at 9 a.m. at the date of April 28, 2021. So after checking the doctor's order, we will now identify the correct patient. So, may buntag, ma'am.
May buntag.
Unsa man itong kung pangalan?
Julia Mayumi.
Okay. Yan, ano sa itong birthday?
January 24, 1984.
Okay. Yan, pwede tanawin mo ang patient number?
2020-97648.
Okay, 2020-97648. Okay. So, karon di ay kay ang naka-assign naman na doctor, si Dr. Herrera, kay na siya gipa ko ng order na ko na mag-start og IV therapy nimo with plain normal saline solution at 1 liter at 20 drops per minute. So, kani siya, ka-record siya para matabangan kasi imahang ka ng condition karon. So, okay ba nimo na butangan ka ng IV?
Okay ra.
Sige. After explaining the procedure to the patient, we will now prepare all the needed equipments such as the kidney basin, the plain normal saline solution, and the administration set. Then after preparing all the needed equipments, we will now wash our hands. After washing our hands, we will now check the label and expiration date of the IV bag, then remove the outer wrapper if applicable. So I'll check the expiration on the label. So I said that here it's plain normal saline solution. Then the expiration date is October 2023. Then after checking, we will now label the IV solution with the patient's name, solution type, amount, additives, rate of flow, date, time of start, and expected consumption of using the agency tag. So I have pasted the tag here, so I will just write the necessary information. So name of patient is Julia Mayumi. And then bed is surgical ward, bed number 1. Then this is her first bottle, so I'll write bottle number 1. Then the IV fluid and rate, I'll write plain normal saline solution 1 liter at 20 drops per minute. Then there's no med infused, so we'll write none or NA. Then the date and time start is April 28, 2021, then 9 a.m. Then the date and time ended is April 28, 2021, 2 p.m. So this will be affixed by my signature and my name, as well as my CI. Then after labeling the IV solution, we will now check the IV administration set label for type and G factor, as well as expiration date. So this one is an adult infusion set at 20 microdrops per milliliter. And its expiration date is June 10, 2023. After checking the IV administration set, we will now remove its packaging. Then after removing the packaging, we will now close the roller clamp or side clamp on the administration set. So we'll close it. Okay, so it's closed. So after closing the roller clamp, we will now invert the IV solution container and remove the protective covering on the entry port. Okay, so we're done removing it. So now we will use a twisting and pushing motion and firmly spike the IV container at the entry port. So we'll now spike it. Okay. So now we're gonna hang the IV container on the IV pole. So now we're gonna squeeze a drip changer and fill it at least halfway. So we're gonna squeeze it. Okay. So that's about halfway. After filling it halfway, we will now remove the end cap and prime the tube by allowing the IV fluid to flow through the tubing. So we'll remove the end cap. Then we'll open the clamp to allow fluid to come through. Okay, fluid is flowing. Once fully primed, we will now close the clamp. So after closing the clamp, we will now check for bubbles, and if there are bubbles, we will try to eliminate them. Okay, so there are no bubbles in the tube. We're gonna attach the lower lock with the IV catheter, and afterwards we're gonna regulate the fluid according to the doctor's order, which is 20 drops per minute. Okay, we're gonna cut a full minute. So okay, so it's 20 drops per minute, is correct. And now we're gonna document as per agency policy. So today is April 28, 2021, and it's 9 a.m. The type of solution is chlorine normal saline solution. Amount is 1 liter, and rate is 20 drops per minute. Started by Micro de la Cruz. Then no medication was infused, and so no medication added, so it's none. So this is the IV fluid record. After all the procedures, we will now wash our hands.